CNN has learned President Biden will announce the next phase of his pandemic response in a speech on Thursday. It comes as the United States surpasses 40 million coronavirus cases today. Notably, hospitalizations from COVID have more than doubled since last Labor Day. ICUs are reaching a breaking point in several states. Alabama and Central Texas reporting they are out of intensive care beds. The U.S. is now averaging nearly 1,500 coronavirus deaths a day, and we have to point out the vast majority of those are preventable. Joining us now is Dr. Jane Morgan. She's the executive director of the Piedmont Healthcare COVID Task Force in Georgia. It's actually the largest healthcare system in the state. Doctor, always a pleasure to have your expertise on. Thank you for joining us. I want to ask you about what you're seeing at your hospitals. Georgia is reporting ICU beds now at more than 90% capacity. What does that mean for your staff and your patients? I wonder if doctors are having to make tough choices about who to care for.
Yes, certainly. Thank you for having me today, Boris. And Piedmont Healthcare here in the state of Georgia is the single largest healthcare system here. And so the numbers we see in Georgia certainly are reflective of what we're seeing as well at Piedmont. And so there's a lot of concern about ICU capacity, but there's also concern about our staff capacity, and not just in people being able to show up to work physically, that capacity mentally and emotionally, because this particular surge, this fourth surge, is the first surge that we have had that's entirely preventable, that is driven exclusively by behavior. And we're starting to see a lot of fatigue, mental and emotional fatigue and exhaustion in all of these frontline healthcare workers who are exposing themselves and risking themselves every single day to save lives.
It's nearly a year and a half of grueling round-the-clock work, putting themselves at risk to help others. And you're absolutely right that it's a different layer now that we have vaccines and it's preventable. I also want to get your thoughts on President Biden set to speak to the nation on Thursday about the White House's COVID response. What are you hoping to hear from the president?
So what we're hoping to hear is some direction on these boosters. We certainly would like to see the FDA and the CDC endorse these booster shots. And where are we with them? At the 6-month mark, at the 8-month mark? And so we need to have some direction on that. I frequently get questions regarding whether or not we can mix and match these vaccines for boosters, and that answer is probably yes. We don't have data on that yet. We're expecting some data to come out in the next 2 to 3 weeks, but the fact of the matter is that answer is probably yes. And more specifically, we really want to hear more data absolutely on this Johnson & Johnson vaccine as well. We know a single dose had a 72% efficacy against symptomatic infection, which actually is more potent than a single dose of Moderna or Pfizer. And so that was one of the reasons they went forward with a single dose regimen as opposed to a 2-dose regimen. But we'd like to see that data come forward. I think what we're going to find is that the regimen of these vaccines, not boosters, is actually a 3-dose regimen for Moderna and Pfizer and a 2-dose regimen for Johnson & Johnson, similar to our hepatitis vaccines.
And Doctor, we understand that as part of President Biden's speech, he's going to talk about vaccine requirements, what the administration might do in regard to schools and businesses. What are your thoughts on what needs to be done from that perspective to encourage more people to get vaccinated?
So I think as we move forward with our vaccinations and these mandates, and perhaps even we should use a different terminology than mandates, maybe a dress code or requirement or corporate requirement, but I think mandate is also a word that people push against. But what we would like to see is we start to see more and more corporations and entities and organizations and governmental agencies begin to say, we need you to have this vaccine in order to work here to create a safe environment. We're hoping to see that vaccination uptake begin to uptick. And as we do that, we begin to create a safer and safer environment around our children, because children's infectivity is not only related to their exposure at school, it's related to the amount of virus in their community as well. And we want to begin to address that community virus that's surrounding their children while they're in school.
Yeah, and there's no question the rate of infection among children has been going up, so it's something that urgently needs to be addressed. Dr. Jane Morgan, we have to leave the conversation there. Always appreciate hearing from you.
Thanks, Boris.